I'm Atlas Whitaker, digital anchor for the Journal of Special Operations Medicine. For more than 25 years, the JSOM has occupied a unique place in military and operational medicine, bringing peer-reviewed research, lessons from the field, and evolving clinical guidance to the people responsible for delivering medicine where conventional systems often end. And the summer 2026 edition shows exactly why that matters. This issue examines some of the most consequential challenges facing operational medicine today. How do you use increasingly sophisticated medical technology without creating a new tactical vulnerability? One study examines the detectable emissions produced by handheld ultrasound systems and what those signatures could mean in a contested environment. Another explores expeditionary point-of-care ultrasound and the need to think differently about how this capability is trained, equipped, and employed in combat and austere settings. We look at telemedicine through lessons learned from real-world pararescue experience, where reaching expertise remotely can become critical when distance, isolation, and delayed evacuation separate a provider from higher levels of care. Hemorrhage control remains central. This edition examines tourniquet pressure and distribution during limb application, as well as a case series involving trauma gel for hemorrhage control and tourniquet removal. There's also research into colorimetric capnography for confirming thoracostomy placement, development of a militarily relevant femoral dual-lumen cannula for extracorporeal life support, and far-forward infection control in modern warfare. But operational medicine isn't only about equipment and clinical interventions. This issue examines predictors of success in military special operations courses and challenges how we think about the tactical athlete, operational readiness, and support. And in There I Was, lessons from a trench fight in Ukraine raise a deceptively simple question: is one IFAC enough for modern war? The summer edition also includes the May 2026 Tactical Combat Casualty Care Guidelines and an update addressing analgesia in TCCC, putting current guidance directly alongside the research and operational experience that continue to shape battlefield medicine. Research, clinical evidence, lessons learned, emerging technology, current TCCC guidance, and the experiences of people actually operating in these environments. All in one place, in one trusted PubMed indexed resource. The summer 2026 edition of the Journal of Special Operations Medicine is available now.